Are you one of those dentists who are having difficulty in converting patients? Walk-ins are there, but you're not able to convert those patients. Where is the roadblock? There are a lot of factors, but one of the most important factor is technology. Today I'm going to give you something which can truly revolutionize your practice. It has changed my practice. How? Well guys, I'm Dr. Kunal Banka. Today I'm going to talk about the importance of dental scanner, intraoral scanner in our practice. Well, technology is always expensive, and that is why we shy away from it. We think it's not the right time for us to invest in that technology right away. But technology is an essential part of growing in our profession. As dentists, our handwork is very important, our skills are very important, our art is very important, but at the same time, we need equipments, we need instruments, modern technology to give the best care to our patients. And how does intraoral scanner help us? Well, it's a miracle. Usually it was thought that intraoral scanner is only used to make impressions. It can only replace impressions. But what has it done? Intraoral scanners, number one, has made the treatment very fast and accurate, because when we scan the patient's mouth, you can just mail it to the lab immediately and the work comes back very fast. That's the biggest advantage. Another advantage, which is mostly overlooked, is the use of intraoral scanner as a diagnostic technique. Well, when a patient walks in, what do? We do a scan consultation. We just don't do a visual examination. We scan every tooth of the patient's mouth, we scan every corner of the patient's mouth. And then, when we show the patient on the screen what is there in your mouth, how many caries are there, how many decays are there, where are the missing areas, where you need to place an implant, patient really understands. Because whatever we talk to the patient won't understand it until and unless the patient sees it, because mostly we are talking in technical jargon. Okay, we don't want patient to go into a lot of technicalities. We want that patient understands what we speak, and to do that, they need to see what is there in their mouth. So for us, it's very easy to see in the patient's mouth and say, oh, you have 2 cavities and you need 2 implants and 1 extraction. What does it mean for the patient? It doesn't mean anything for the patient, because patient has not seen what is inside his mouth. Now, some people might ask that intraoral cameras do the same thing. Why not intraoral cameras when they're cheaper? Well, intraoral cameras may be doing the same thing, but the precision and the impact of intraoral scanner is million times more than an intraoral camera. And intraoral scanner is much more comfortable to use even for you and for the patient. It hardly takes 5 minutes for a full mouth scan, but imagine you scan the patient's mouth on the first consultation. You give them the report, because most of the scanners generate a general checkup report also using AI. You generate that report, print it, give it to the patient on the consultation, show them what is required in their mouth, and then let them think over it. Well, I guess none of the patients will refuse the treatment if you do this much to the patient. Then where is the cause of rejection? Rejection happens only because we don't invest too much into the patient, we don't give them so much time, or we give them extra importance. Patients feel that we don't want to lose the case, or we are not using the technology properly. And I feel intraoral scanner is a blessing. These days, I use intraoral scanner just as a mouth mirror. Every day, every patient, every time. Intraoral scanner is a compulsion in my practice. You should make it too. Scanners are not very expensive these days. The prices have come down. Make the best use of intraoral scanner, guys, and I'm sure your conversion rates will double for sure immediately. So if you're not invested in a good intraoral scanner, please do that now. Whole month of February, I'll be talking about few more tips and tricks of growing your practice. So guys, stay tuned to my YouTube channel, Wisemolars, and keep watching this space for more tips and implement them in your practice. If there is any question, if there is any queries, just don't hesitate to drop a direct message to me or my team. We will get back to you right away with your questions and answers. We are here to help you always.